At least 1 in 4 people consider themselves to be heavy sweaters. While most sufferers don't complain about this, a significant percentage do. Most people don't appreciate the problems that excessive sweating causes, and we tend to dismiss the complaint as being trivial. The medical term for excessive sweating is hyperhidrosis, and hyperhidrosis can affect many parts of the body, including your palms, soles, forehead, face, underarm area, and the back and chest areas too. So what's the big deal? Believe it or not, hyperhidrosis adversely affects the patient's quality of life in so many different ways. Firstly, it can cause social isolation and avoidance of certain activities, as well as social and emotional embarrassment. Many people complain about their soiled and stained clothing. Body odor is a frequent complaint, even in people who don't sweat that much. Excessive sweating may cause inflammation of the skin and dermatitis, and occasionally even increases the risk of skin infections. And finally, hyperhidrosis often disrupts one's daily routine. Wet clothing may have to be changed several times a day. So now you can see what a huge impact excessive sweating can have on a person's life, and consequently these people are always seeking advice as how to minimize the problem. Apart from using a clinical strength antiperspirant to decrease wetness and odor in the armpits, there are several other approaches that one can adopt to reduce hyperhidrosis in other areas of the body. Some of these are fairly invasive. There's an operation where nerves in the spinal cord are cut. This is usually a last resort. Botox injected into the affected areas can be very helpful. This, however, is painful and expensive and has to be redone every 4 to 8 months. Daily management of excessive sweating includes avoid tight-fitting and synthetic clothing, as well as foods such as garlic, onions, spicy foods, caffeine and alcohol, as they aggravate the condition.